Hey guys, just completed week one of clinicals, and it was a good week. It went by really fast. The first day of clinicals, got up bright and early on Monday, which I don't get up that early, but I don't sleep in late anymore. But it was still tough getting up at like 5:45. But, got there bright and early and met my classmates, and it was just an orientation day, so we didn't really get into the hospital. I mean, we got obviously we got in, but not into the onto the floor or anything, um, because we had to do these like modules about confidentiality and compliance and stuff before we could actually get on the floor. So we had to do that. Um, so that was a really short day, and then so we just met everyone, and I like all my classmates again. Um, and then on Tuesday, we actually got into the hospital and we got a tour and saw our floor. We're going to be on a cardiac step down floor. It's a telemetry floor. Um, so it's just people coming out of ICU, I guess. So that was cool. When we were giving the tour, um, we saw it was really early, so most patients were still sleeping. Um, but I saw a patient, out of the corner of my eye, and then it kind of hit me like, whoa, like we're gonna be with real people now. Like this is no joke. This is serious. Um, so we did like a little scavenger hunt, and they gave us this great student orientation booklet, which is just it's got a lot of good stuff in it, just for general nursing knowledge. It's very cool, and so I was looking through that, and that was really fun and interesting to look through. And then we got to shadow a nurse. We shadowed a nurse for about 2 hours, and my nurse was really cool. She was very nice and very fast. She was like a fast little lady. Um, she had to take blood from a patient, and she had to take it to the, I don't know what you call it, so she had to put the little vials of blood, the little tubes of blood, and put it in this canister thing, and then it into this machine that you like when you go to the bank in the drive-thru, it goes sucks it up. So that's so we had to like run out. Basically, I had to jog to keep up with her. She's like, "I'm sorry, I walk fast," and I'm like, "It's cool, I'm a runner." Um, but she was really neat, and I'm glad I was paired with her. I think it was a good match. And obviously, I won't say her name, but she was really fun. She had about 4 patients while I was there. Uh, and so I just followed her. She was trying to give her meds, and she kept getting pulled 5 different ways, and it really gave me a little bit of insight into how a nurse can get burned out. Because she's trying to do her meds, and some of them are late, and with the you can do it within an hour. So some of them were a little early or on time. Um, and she kept getting, respiratory to do something, and she kept, the other nurses need stuff from her, and, they have their phones on them at all times in case they get paged. So that was ringing every 5 minutes. Um, you know, she got a call from, I think, the lab that was like, you were supposed to get this kind of tube, and she was like, no, I was only told to get a yellow top, and they're like, no, and she's like, well, it's been heparinized, so you're just gonna have to come and do a peripheral poke. um and then you got the patient saying, hey, I'm still hungry, I want another pancake, my coffee is cold. um so as a nurse, you're just getting pulled 10 different ways, and that was only within 2 hours that and she was just trying to pass her meds. I think within that 2 hours, she could only get meds to like 1 or 2 patients while I was with her because she was just getting pulled in all these different directions. Um, but she was showing me how to, how they get the meds and this hospital is great. It's a smaller hospital. Um, and the little medicine, like each patient has their own little medicine cubby in the room, and you got the key if it's locked, obviously. I don't think the patients really know where it is. Um, so you didn't have to go like anywhere, and they just switched to computerized charting, so everything was a little frantic because the nurses were just getting used to it. Like literally, they made the official switch like midnight that day. Um, so she was showing me like pulling off the meds, and they're in like little units, which she said she loved. So she's like comparing it to the MAR, and like okay, and doing the checks like we were taught, and making sure she had everything. And one patient who's a nice guy, he had a dialysis shunt in his right arm, like right here. I can't see it there, right there. And she's like, "Oh, you have a stethoscope. If you can listen to it, and you can hear like the whole vascular system." So I put on gloves, of course, wash my hands, put on gloves, put on my stethoscope, and I could hear it, and it was like. And that was so cool because that was like the first time I'd ever heard anything like real, other than like my own heartbeat and the heartbeat of my classmates and Scott. um, and then she was listening to his lung sounds. They got to do the assessment. And she's like, "Here, you can listen to his." She was doing it in the front, and she's like, "Just get your stethoscope, and you can listen on the back." And I don't know if I had it in the wrong spot or if my stethoscope was turned the wrong way. I think I might have just put the ears in the wrong way, but I couldn't hear anything. I think that was it. I think I put it in wrong. But she said his lung sounds were clear. um, so that was really fun. I did miss out on. I could have gone with one of the patients to see a barium swallow evaluation, as one of her patients was going down to get that done. And she was like, "Oh, it's too bad. You could have seen that." But next time I'll be with patients for the next 6 weeks, 5 weeks. No, 6 weeks. um, so, so that was fun, and then we called it a day. And then my theory class is cool. I really like my professor in my theory class because she's been a practicing nurse for 15 years, and she's very thorough with the chapters, and we go through each thing and we have discussions, and she asks us questions, and it's very interactive, and she's just really cool. She knows exactly what she's doing with us as baby nurses. That was another thing. We had to get a new classroom, and a class was leaving before we got in there, and it was a nursing 210 class, and that's one of the second year. I don't know if it's med-surg 3 or 4 students, or one of the higher level classes. But they were passing us like, "Oh, look how cute they are, the little nurslings." And I was like, "Yeah, we're just baby nurses." And they're like, "Hang in there, don't give up the fight." So that's kind of fun. Hopefully I'll be there, trying to root on the nurslings. Um, so that was week 1. I do have some studying to do. I really like what we're reading in med-surg. We're talking about the perioperative patient, and we'll be talking about pain next week. What else? Oh, next week in clinicals, that's when we're really going to start getting into the meat of things. We're going to do full AM care, which brushing the teeth and giving the bath and doing a head-to-toe assessment. So I'll have to do a little refresher course on baths, and we didn't actually do the teeth brushing thing. So I'll have to, just read through that. I doubt it's any big deal. But that's it. And then Tuesday, we might not even have clinicals. I know we won't have classes, but my school every year has this district conference thing, so the district is closed. So no classes, but I don't know about clinicals, and if we don't, we'll probably have to make it up, I don't know, at the end of the semester or something. Because we have to have 90 clinical hours. So that was week 1. I'm excited for week 2. I'm just ready to go, and a little bit nervous, but I'm just thinking of my patients, and I'm going to be putting their comfort and safety first before my own nervousness is left at the door, because this is the job. And I'm excited. I'm excited to get started. So I will see you guys next week, and I will let you know how it went. Bye. Have a good rest of the weekend.